I just wanted to welcome you all formally to this lunchtime seminar. My name is Fergal O'Brien and I work as the Regional Coordinator for the Social Work and Community Development Approaches. It's a postgraduate programme, and many of you actually, I can see some names of people that have actually come on to that, and today's speakers will be largely drawn from that, who have come from different sectors and settings. And I'm actually delighted to see a huge interest actually for next year's course, because the closing date's today, and I can see them coming from all across Northern Ireland, which I'm delighted about. But that's a separate subject. So really, the theme and the inspiration for this particular programme today is really widening community development. A lot of our examples that we've kind of been bringing so far have come from the health and social care sector. And I wanted to really use this opportunity today to show that community development is not just contained, if you like, it's not confined within the health and social care. It's relevant right across many other sectors and settings. And certainly there's community development workers right across every government department actually would have their groups that they link with. Never mind, within the Department of Health, Department of Justice, Education, you could go right out. And it's really essentially, it's about like taking, moving, I suppose, some of the approaches beyond just casework to look at a collective action. I mean, that's really what we're looking at, is like, we're looking at another methodology, if you like, that has sort of been a bit neglected over the years within the training element, and it's really making a comeback within the context ever since the whole reform of social care that was coming in, the transforming social care from 2011, where we're kind of saying we can't keep going the way we're going, the profile's changing, we need to get into earlier intervention and prevention. And those themes of early intervention, prevention and community development are right across sectors and settings. And we're really looking forward to introducing you to some examples. We've one exception from the health and social care, but I really wanted to bring Michael in towards the end, because we've had the Jones report, and that's going to have a profound effect, and it is having a profound effect on the kind of thinking within children's services, and we haven't really captured that until today. So we're going to bring Michael in to show you what's happening within childcare post-Jones, but everybody else is from other sectors and settings. But before we do any of this, right at the centre of social work is the whole idea of co-production, of working with, extroverts by experience rather than working for. And I'm delighted to introduce you to Brendan McKeever as our first speaker. I met Brendan in Derry, a very, very interesting fellow who was involved in the campaign to abolish means testing when it comes to housing adaptations for parents whose child had a disability. And I'll let him tell you about him. But I've asked him to independently review the NISC website from a service user perspective. So over to you, Brendan. I'm really keen that away you go, and good luck with your presentation.
Thanks very much, Fergal. I'm glad to be here today, but Fergal might be glad I met him. That's the only problem. So basically, I retired. And in my retirement, I've reflected on the work I've been involved in over the years with families of disabled children. I work with them full-time for about 10, 11 years in Derry and wider than that. And I come from that, what we call a lived experience, where we had a disabled child ourselves. And that's what kind of was the birth of this stuff for me. I knew nothing about anything. And one of the things now, in hindsight, looking back, is I believe up front that those who use services in whatever form, whatever it is, have got a knowledge base, have got experience, and if they're facilitated and meet people, maybe like Fergal and a lot of other people I met along the way, they become empowered in themselves through the process. And I'll come back to empowerment in a wee while, because I have a few words to say to Fergal about that. So basically that's where I come from, and been involved over the years, and I actually was an original member of the Northern Ireland Social Care Council when that was first formed, and that was kind of a really lovely time, because before we even got registration, we were working on this kind of stuff when nobody really else was working on it. and I got a lesson from them on partnership working very quickly. I was tasked, because of my background, to design a leaflet on occupational standards, which I hadn't a clue about, to be honest. And then basically, when it was done, the week group I was in was saying, right, let's go with Bretton's version. And then a senior member of staff said, but hold on a minute, are we sure it covers what we need to cover? And then we done a brochure together, which done all those things. So it was like a mini partnership working. So what I had done is I looked at the course briefly that Fergal asked me to look from, and I wanted to do the positive sides of that first, if you don't mind. Basically, what I picked up from the course, which I think is very good and would recommend it to anybody who is in the field of social work and other professions, but I wouldn't recommend it to those who use services, basically because of the language in it. And it's a thing we use acronyms, which I was also a member of the health board as a member for about 10 years as well. And he sneezed there, and there was an acronym after it. That's what I thought. So the use of acronyms, the use of terms that are associated with a profession that nobody else outside that world knows about. But that's something that I think, if you're going to do a course in community development, those running that course also have to look at themselves and not just do it for people who come from a background like me do, but do it because it's the right thing to do. So basically, that was one of the first criticisms I had of that before I went to positives. The second was, and it really bugged me, is this idea that you can empower people. You can't. I don't believe you can empower people. What I think you can do is facilitate empowerment, because the parents that I work with would tell you at the beginning they couldn't write, they couldn't speak, they couldn't do anything, and they always thought they would be measured as a coping exercise. But as the work we done long before the housing campaign was basically to make them aware of their own experience, and we supported each other through that process, but we weren't a support group. So I, with a number of other parents, formed a group as an advocacy group, and that was our role. It wasn't service delivery, and we ran courses. I was tasked to write books on issues that affected families, etc., etc. But that, maybe you can get empowered by courses and stuff, but I do not believe that you can empower people, because if you're into a situation where you believe that you have power over somebody, you cannot build a relationship. It's not the right thing to do. Now, people can, I'm open to criticism of that, but I believe that's where I come from, and I will always say that as well. I believe in that. But also through the process I was involved in, I learned, and it was a lesson that I had to learn, is that you can work with professionals. Because when we came to the housing campaign, we didn't know what we were doing. All we knew, there was something wrong, drastically wrong, that parents could not access that grant called a disabled program because of a means test. And we were told, but you can't change the means test. That's another benefit. And we said, but it needs changed. And we fought as part of another group called Homesteads for Children, where eventually, against all odds, the means test was abolished, first in Northern Ireland, then in Wales, and of course England held out to the last minute, and then in England. And we were ordinary people, and I was invited in because I was a parent, and other parents were invited in because they knew they could only get so far. And all the resources that I have on that kind of material and my background is on your own resource, so I don't want to go into too much detail with that. But the course itself, if you remember anything, I think the course is innovative. I think it's the use of, I know you call them stories, but I would call them narratives, because a story to me has a beginning, a middle, and an end. This journey we're on doesn't have an end. And basically, those, if it was me to design the course, I would get that up front before anybody speaks. Get it grounded in what it's supposed to be grounded. And the other thing, I'm not going to speak very long because I feel I want other people to speak today. But at the end of this, I put up this weekend in motion about the course. And the course, I think, is going to develop, if you take on board what I say, very cheeky before. But basically, I've got pause. Let's pause. Just what we're doing today. Pause, look, listen, reflect, and act. And we do that periodically but you're reflecting not just on people like me, you're reflecting people doing the course, the social worker. You feed in to see how you're getting on. You feed out, is these issues or not issues? And then you address them and you act on them. And if that's a continuous stress community. And the other thing is, I do come from Derry. It's the second city. We've made Field the second city in Northern Ireland for many. So we've had to do things ourselves. So you'd like to John Hume, who developed a credit union. I have people I work with in the community who develop community development. But one thing I have to say, most people don't know about it. They live it. Every day they live it. You talk about personal public involvement, co-production, co-design. That's people living. And people forget that some of the involvement now, as far as I'm concerned, has gone on in an academic field with its own language, and it's crazy. But it's hard. And one final thing I want to say before I go, I met someone once who I worked very closely who was a senior social worker who did lead up a centre in Derry. And basically, his quote was, "It's about relationships." It took me a long time to realise that's what it was about. And that's all. That's the answer. And if one final thing, if you ever question why people like me can campaign for years and years and years, and other campaigns can do that, you have not got the message. And you have to find out yourself. You have no option. No option. Thanks, Fergal.
I really much appreciate what you're saying as a complete independent voice, and you've spoken very, very well on all of those issues. And just to sort of say that whenever we were doing the video that you saw at the start, at that stage we've updated with another video from Brendan. He was involved with other folks across Northern Ireland on the co-production publication and on the torch model. So we have updated the website that we're really trying to promote today as well with that video under the Hero Voices, but also we've updated with some of Brendan's many publications, both at the very end on the publication section and under Hero Voices. But I'm very, very grateful to you, Brendan, for coming forward and for sharing your experience and your wisdom, and certainly taken on board, and I'm delighted to have it recorded today. I'm going to move on now to the next speaker, and as I sort of say, a lot of the examples that have been captured so far, I suppose, on that website of community development practice have been sort of health focused. I'm going to turn to probation, to the justice sector, and I'm going to ask for Annie McAnallen to just talk a bit about the project that she got involved with on the course with lifers. And there's a really interesting one because she's the first person to actually take some of the knowledge from this course into the justice sector. And we've had two more fascinating people this year looking at issues. So over to you, Annie, and good luck with your presentation.
Thank you, Phil. That's sharing.
That's sharing, lovely, thank you.
Good afternoon, everyone. My name is Annie McAnallen and I'm a probation officer. I work with the Probation Board for Northern Ireland, and like all probation officers here, I'm a qualified social worker. In probation, we work with people who have committed offences to reduce their reoffending and to keep the public safe. My community development project focuses on a distinct group of individuals who were sentenced to life imprisonment and are now living in our community on life licence. When somebody is sentenced to life imprisonment here in Northern Ireland, that rarely means imprisonment for the rest of their life. Most people are eventually released back into their community once they're assessed safe to do so, on strict licence conditions. They can be recalled back to prison at any time until their death if their risk increases, if they place others at risk, and if they breach their conditions. As a group, they can be understood as a community of interest because they share a very specific and often very complex experience. This project looks at what works in supporting their rehabilitation and resettlement back into the community, here in ways that are safe for them and the community in which they live. It's important to be clear here that our role as probation officers, when we are supervising and supporting someone in life licence, we're not trying to minimise the seriousness of their offending behaviour We're not attempting to erase the harm that they've caused to victims and families. A life licence is not intended to diminish the pain that has been caused or indeed to forget the harm. Rather, supporting someone in life licence means recognising that some people, having served a very long time in prison, may actually be able to live safely in our community under robust supervision and licence conditions without placing that community at risk. This project is about exploring what works and supporting that process of rehabilitation and resettlement. The idea of resettlement after being in prison on a life sentence can understandably provoke strong public reaction. It can raise some very difficult questions for us about justice, about public safety, accountability and punishment, and whether people can really change and should be allowed to live within our communities, having committed some of the most serious offences, often involving the loss of life. As probation officers, we believe in a fair and credible justice system, one that manages and balances accountability and punishment with the possibility for hope and rehabilitation. This belief system is reflected not only in our local legislation, but also in international laws and standards that emphasise that imprisonment should, as far as possible, prepare people for a law-abiding life and release. And that is the context for my project. And there's a quote by Marian Wright Engelmann, and she says that the way a society treats its elderly, its children and its prisoners speaks volumes about its values. In this quote, we are challenged to think about what should happen to people who commit serious offences. It asks us to consider, what does justice really look like? Is it only about punishment, or can it also be about dignity, rehabilitation, reintegration and the possibility of change? When we think about people in life licence, that is exactly the challenge that we face. How do we protect the public, recognise the seriousness of the past, and still work in ways that support people subject to life licence to live safely and responsibly in their communities? So why this project? I can quite literally remember my legs going weak when I was allocated one of my first lifers. Looking back now, I can wholeheartedly reflect on how much the individuals I work with taught me about doing my job. It's often that type of feedback that has the most to teach us if we're prepared to listen. It was by listening to the men's experience, hearing what it was like to live on life licence, what that can really be like. I came to better understand the challenges of returning to the community and also what actually helps to navigate those challenges without putting the public at risk. My time with lifers taught me about the critical importance of being authentic, of being firm but fair, being honest, trustworthy, open and respectful, of doing what you say you will do, following through on promises, of listening, of turning up, and of holding hope. They taught me that it is how you are with people that matters the most, not simply what you do, but how you do it, not the theory or the paperwork, but being real and being present. These are the qualities that matter the most. So when I secured a place in this community development programme, I knew immediately that I wanted to do something that captured that collective wisdom of the lifers that I worked with and what they had taught me. In an age where lived experience and co-production in criminal justice is becoming increasingly valued, this project is providing a small opportunity to hear directly from those most affected by our work and allow their voices to inform and develop our practice. Through a literature review that I completed on the course, I found that there was very limited research, and so this points to a clear evidence gap locally. We cannot simply apply what we know about short-term prisoners to people who have spent many years in custody. Their experiences, their needs and their challenges will be very different, let alone their offences. We know that transition after many years in prison can itself be uniquely challenging, with a range of practical, institutional and psychological barriers. There's a growing recognition now in trauma-informed practice that long-term imprisonment in and itself can be psychologically very damaging. There's some new interesting research describing a phenomenon called post-incarceration syndrome, which is similar to PTSD, and this is found to be common within our lifer community. My own community audit that I completed in the course found 6 recurring areas of need during lifer resettlement. Lifers were experiencing accommodation difficulties, financial pressures, uncertainty and challenges about how to spend their time meaningfully, psychological and social difficulties, relationship issues, and problems with substance use. At the same time, public concern about safety is very real and it cannot be ignored. But fear on its own does not help us build effective practice that keeps people safe. If people are going to live on life licence in our community, we need to understand what supports their safe resettlement, what reduces their risk, and what actually helps. We need to know how they will be safe and how the community will be kept safe. We also know that reoffending rates for this group are particularly low. Most people released on life licence do not reoffend. That reflects the careful scrutiny, the robust assessments, and the careful management that is involved. Risks are simply not taken lightly with this community of individuals. So for me, this project matters because it offers an opportunity to deepen our understanding of life and life licence in Northern Ireland. It can help us improve how we support people to resettle safely and successfully, tapping into the expertise of those who hold vital insights about their own experiences, whilst also keeping an eye on public safety. It's about improving the way we work with individuals on life licence to integrate them successfully and to ensure the support and supervision that they receive in the community is strong, robust, thoughtful, effective and grounded in the evidence, and importantly, doesn't put others at risk. The overall aim of my project is to co-produce a practical resource for probation officers working with individuals on life licence. I wanted this resource to be grounded in real life, local experience and be used by probation officers in their day-to-day practice, not something that was theoretical or abstract. And so to do that, I set out 4 objectives. And the first one was to establish a working group, and that meant bringing the right people together. But I soon realised it was not just those with lived experience of being on life licence that was important. This project also offered me an opportunity to tap into the collective expertise of some staff who work with lifers, from both within the probation service and our partners in the community sector. Some of these people have developed an expertise and for some a lifetime of work in this area. And I wanted to tap into that as well and bring both the expertise from lived experience together with the practice wisdom of a small group of professionals with extensive knowledge in this area. My working group is now up and running. We're a small group of 7. And being a small group is one of our strengths because it allows us a degree of intimacy that fosters genuine collaboration, reflective discussions, and a process that is grounded in safety, trust, and practical relevance. This group remains active and we are progressing on our project. My second objective was to identify what actually works in resettlement here. Our discussions have focused on the realities of support, supervision, relationships, and barriers, and what actually makes the biggest difference in practice. And interestingly, it's the working relationship and how that is nurtured that seems to be key. The third objective is to develop the resource itself. We're now at the stage where we have a working draft and we're in the process of refining that draft so that it reflects the collective voice of the group and remains practical and relevant for staff. And our final objective then will be to evaluate the impact of the resource. Once the resource is available within our service, we will look at how useful and meaningful it is, how probation officers are using it to inform their work, honing in on what is important in this unique and often hidden area of practice. The project takes a community development approach, which is essentially a way of working directly with the community, not simply making decisions on behalf of or about that community. It means recognising the strengths, drawing on lived experience, and also creating space for people to shape responses to the issues that affect them. And that distinction is really matters. This is not research on people, it is research with people. The resource is being developed collaboratively with people with direct experience of life licence, alongside probation practitioners and community partners who have substantial knowledge and experience of supporting this community. The project uses elements of participatory action research methodology. So in simple terms, that approach has 3 components. The first one is we work together. Second one is we learn together, and the third one is that we create something together. This project follows the 6 building blocks described by Cornish and others in their paper in 2023, which is about building relationships, establishing our working practices, developing our shared understanding, gathering the material and information, then collaboratively analysing that, and then planning actions. The approach in participatory action research projects is as much about how the process takes place as it is about the final product or the outcome. Collaboration in this type of project is really important, but it is not straightforward. It requires humility, it requires openness, a willingness to share power. It depends on trust, on creating a space where different perspectives can be heard honestly and where different priorities can be negotiated. and where we can work through any disagreements in a way that's honest and non-threatening. The success of the project depends not only on participation, but on the quality of the relationships that make that participation meaningful. An important part of my project is recognising and drawing on the strengths within the group itself. This project has allowed people to contribute their different skill sets and insights, whether that be their lived experience or professional knowledge, or even proofreading, editing, design, or even making the buns. So the process itself reflects the wider principle of co-production. People are not just there to give opinions, they are actively engaged and have ownership of the resource. For me, this is one of the most important parts of the project. It is not only about producing a resource, it is about producing it in a collaborative way. So thinking about the outcomes, essentially the main outcome is to co-produce an evidence-informed resource for probation officers working with people on life licence in Northern Ireland. This project is helping to fill a gap in our local evidence base. By identifying what works and turning that learning into something practical, it has the potential to support probation officers in their day-to-day work and ultimately support people on life licence to live safely in the community and have safer communities as a result. But even before this final resource is complete, this project has already achieved something important. It has created a space where lived and learned experience can come together on equal terms to shape practice side by side. Co-production in criminal justice can pose challenges, but it is increasingly recognised as a way to improve services by breaking down the barriers between professionals and those who are subject to criminal justice interventions, ensuring that practice is informed by the reality of people's lives. This project is testament to the approach. It has strengthened relationships and it has supported shared learning and given us a clear understanding of what matters most in life of resettlement here. For me, the bigger message in this project is that there's no single magic answer for being an effective probation service. Peter Rayner, who is a renowned probation commentator, reminds us that progress is a gradual, incremental stage. It needs to be informed by evidence and evaluation rather than driven by any ideology or a notion of what we think might feel instinctively right. When our practices fail to take account of the evidence or ignore what lived experience can teach us, clearly we can inadvertently be engaging in a disservice to those we work with and those that we seek to protect. In his very recent research paper, Colin Walsh from Queen's tells us that we can never really prevent reoffending behaviour, but we still are required to do something about it. And that something tends to be a lot of somethings. And ultimately, this project is about doing a little bit of something. It is not simply whether we manage to create a resource, it is challenging us to move beyond instinct, assumption, and a long-standing professional standpoint and our ways of doing things, to really ask us to listen closely, to think critically, to work collaboratively, to allow lived experience to coalesce with practice knowledge, to allow that to shape the future of our practice so that we may actually really understand from the collective wisdom and what that can teach us about what supports people on life licence change, resettle and live safely in their communities. Thank you.
Many thanks for that, Annie. That's very stimulating. Can I just encourage people to use the chat function? You know, I need to keep the thing moving to get you out in time, but if there are any comments, questions to Brendan, Annie, or any of the other speakers, I would encourage you to use the chat function. It's also encouraging to the people who are actually giving the presentations that they know there's somebody out there engaging, you know, so it works both ways. So thank you again, Annie, as being the first representative of probation that we have on the website. Thank you very much for that presentation. I'm going to move on now to another sector we've got our first person, I suppose, on the course from the Education Authority, working as an educational welfare officer, is Paul Eaton. And I know, Paul, you have a great background in community development because you actually started the course a few years ago. You were actually in the YMCA at that stage. So you come back to finish the course in a different setting. So it gives you an interesting perspective across the community voluntary sector as well as the statutory sectors. So you're going to look at the issue of autism from through the lens, if you like, of an EWO, Paul, and you're very welcome.
Thank you very much for the introduction. I just try and share a presentation with you. So can everybody see that okay?
Yeah.
So, as I said, good afternoon. Thank you for the opportunity to present. As Fergal says, originally I started as course working in the charity sector, and then I've moved across to the Education Authority. So it's been an interesting dynamic moving from one side to the other. My name is Paul Eaton, and I've worked as an Education Welfare Officer for around 3 years. In my role, I often work with families where poor attendance isn't just about behaviour, but reflects deeper issues such as anxiety, additional needs, or difficulties within the school environment. This project came directly from that experience. It also comes from recognising that we need to work with families rather than just focusing on attendance as a number or an outcome. The role of an Education Welfare Officer is to work in partnership with families, schools, and other services to reduce absence, support achievement, and help young people reach their full potential. Today, I'll introduce the community development project called Building Blocks. I'll briefly explain how it developed, the thinking behind it, what we did, and what we've learned so far. The title Building Blocks was intentionally chosen. Feedback from parents initially highlighted that the terms such as improving attendance can create pressure or tension. In contrast, this title reflects a more collaborative and supportive approach where parents, schools, and services each contribute as equal partners in building sustainable solutions. So moving on to the need for the project. Again, as I said, the Education Welfare Service works closely with schools, parents, and other professionals to support that attendance and to improve outcomes. Looking at the wider context, we're now seeing a significant increase in autism diagnosis. Around 1 in 17 now have a diagnosis, but not all of these pupils have formal special educational needs support. Provision in mainstream schools for pupils with autism, according to 2025 figures, sits in around 26%. So 1 in 17 in a classroom will have a diagnosis, 1 in 4 schools will have that provision. The Education Minister has now said that all schools will be required to establish special provision within a mainstream setting moving forward. This means schools are increasingly supporting pupils with complex needs, and attendance then can become a real challenge. In my own work, a large part of my caseload involves children with autism or those waiting for assessment. Research shows that these pupils often have lower attendance compared to their peers and much lower than the national average. The research also tells us that barriers to attendance are complex, and this can include anxiety, sensory difficulties, and challenges within the school environment. Importantly, parents often feel they are not fully listened to, despite having a better understanding of their children's needs. Families can also experience stigma or feel disconnected from schools, which makes it harder for them to engage. And this highlights the need for a more inclusive and collaborative approach. The project is guided by key principles from practice and policy direction. The NIST Code of Practice highlights the importance of respecting lived experience and working in partnership. The Education Welfare Service's own transformation programme aims to modernise the service and promote early intervention, and highlights community development and strong partnerships as key to this future approach. So taking a community development approach alongside participatory action research, these are mutually reinforcing, with community development identifying local priorities and building capacity, while participatory action research engages parents as co-researchers to generate evidence and drive collective sustainable change. This is the core of working alongside parents of children with autism to gain their knowledge and experience and to build that sustainable change. Looking at the aims and objectives. The main aim of the project is simple: to listen to parents and use their views to improve practice. More specifically, the project aims to gather parents' perspectives, identify practical strategies, promote inclusive approaches, and strengthen partnerships between home and school. To do this, we initially had set up a small steering group and then a focus group. And this group included the school principal, special educational needs outreach teacher, and 2 or 3 parents from different year groups whose children had autism. This was important because it brought together that professional knowledge and that lived experience. The group worked together to design a questionnaire to gather wider parental views. And we wanted something easy to use, so we chose the Slido platform to present these questions, and this made it simpler for parents to hopefully take part in a relaxed way. One key decision that came from this focus group was to include the questionnaire as part of a school celebration event. Rather than asking parents to attend something formal, we built it into this celebration event where families were already coming into the school. This also allowed classroom visits, helping parents to feel more connected and comfortable in the school setting and to see their own children engaging in class. The feedback collected will be used to shape future work. There's also the potential for wider impact. The findings can be shared with other schools and services, helping to identify common issues and improve and support children more broadly. So the community development intervention itself. The project, as I said, focused on working in partnership with parents to improve attendance. While we worked within an academic timetable, the project timeline was designed as a series of flexible stages rather than fixed deadlines. This reflects the understanding that building trust and relationships takes time to get everybody to come along together at the same pace. The focus group played a key role in shaping the project. While the principal initially helped identify the parents, the group quickly became a space for shared ideas and collaboration. And as been said, we co-designed the questionnaire. We chose the Slido tool for a number of reasons. It allows quick and easy responses. Results were available immediately, and it feels less formal and helping those parents to relax in that setting. A really important part of the project was linking the questionnaire to that school event, with the parents key in the design of the timings and the working for families. So as professionals, we thought we'll run a breakfast. When they come in, we'll meet the parents, we'll do it, that'll get it done. The parents were very quick to tell us that was a daft idea. Because if we were doing a tour of the class, as soon as the child saw their parent, they were wanting to go home. The whole thing had to change to run from 1 o'clock to 2 o'clock. That means they could take their kids home with them. And that was purely coming from the parents' intervention and their knowledge of that and what that would take. This has allowed the parents to engage in a more natural and supportive environment. And an interesting point came from one parent sharing their story of coming to the school with their child in P1, having no previous connection with the school. She said that the first day she got to speak to another parent whose child was in the same class was the sports day. And sports days, as we know, generally happen in June time. This highlights how isolated parents can feel, even when their child is attending school regularly. We also discussed how the school community has changed. Some pupils now travel much longer distances to attend specialist provision, which can make it harder for families to build local connections. This reinforces an important message from community development. Relationships and connection are key to feeling supported. Because of this, parents suggested a follow-up event, specifically in term 1 of the incoming school year. And this would be designed for primary 1 families whose children are coming into the autism class in P1 to help them build those connections, and for the parents of the other year groups to link in with them and to share their experiences. So the outcomes. The project shows that improving attendance is not just about monitoring data or enforcing rules. It's about building trust, understanding needs, and working in partnership. In terms of outcomes, the project has allowed us to gather both quantitative data through the questionnaire and qualitative feedback through parent and feedback from staff involved. This gives us a much fuller picture of what is working and what needs to improve. One early outcome is that the school has already started to implement small changes, such as introducing softer starts to the school day to better support pupils. And this is instead of going straight into their numeracy and their literacy, they're doing something more gentler and more fun or more relaxed for the first 15 minutes of the day, just to help them to settle in. There are also plans to continue these events, helping to build stronger relationships between parents and the school, and parents have suggested that the Slido tool could be used with their children to get their views. And we've also talked about expanding this to include the school staff and then bringing these together. Another important outcome is the potential wider impact. The data can be shared with other professionals to identify common themes and inform practice across multiple schools and services. This snowball effect may highlight training opportunities within EA and enhance support for families more broadly. This shows a project that can sustain and continue into the future. It offers an example of a reproducible template that could be introduced in other schools and with other specific groups. In conclusion, Building Blocks is not just a project, but a reminder that sustainable change happens when we work with families, not around them. By listening to lived experience and building strong relationships, we lay the foundations for lasting improvement. This is not a finished project. It's now an evolving model that the school community can continue and shape and to develop into the future. Thank you very much.
Thank you very much indeed, Paul. Very, very good, and very interesting to see just all the principles of community development in your session. And it's interesting that every one of the speakers so far have mentioned relationships and the importance of relationships. It's interesting even in the training strategy for social workers right into the future at the moment, community development is positioned in priority one, relationship-based practice. So it's very well positioned actually within the training strategy. But I just see that theme coming right across everybody's presentations, and it's great to see social workers at the forefront of that. So without much further ado, I'm going to move across into a new sector as well, a new place. And Catherine McElroy was our first person that came in from the Patient Client Council. And Catherine absolutely took on board her learning and training and stuff from the postgraduate course. And I know that they've remodeled and reshaped the whole Patient Client Council model to really go out to people. And I often think about I used to work as a community worker with travellers in your area, and I remember health visitors' immunisation rates were very, very low, poor outcomes, and they were only literally situated across the road from a traveller site, but they changed their model to actually run a weekly clinic, and they achieved 100%. And there was a lot of barriers, psychological barriers, perceived barriers, all, and in that, and there's something around the models of how we deliver services. So I'm really, really interested now to hear Catherine's award-winning model. It will be presented to you. So this was acknowledged now in a leadership award. So
thank you, Fergal. Good afternoon, everyone. My name is Catherine McElroy, and I'm the Principal Practitioner for Advocacy in the Patient and Client Council. And the PCC, is probably maybe not a very widely known organisation, but we're an arm's length body under the Department of Health, and we're mandated to ensure the voice of patients and members of the public are heard in relation to engagement, policy development, and in casework in relation to concerns around their health and social care. I'm a social worker myself of 35 years standing, and I suppose the postgraduate course in community development came along at a time where I was thinking that my career was coming to an end. I had done everything I needed to do. I'd completed all the tiers of post qualifying development, but it came at a time when the PCC were looking towards a community development practice model, and therefore I was able to link into that as well as receiving my specialist award. So I'm going to, outline for you how community development in general has become embedded in the PCC. We'll reference my original project and two subsequent projects where other social workers who are working with the PCC have developed. So how it all started. So the postgraduate community development course that I took part in 2023 to 2024. And the first project that I undertook was in relation to community engagement with the migrant community in a small town in the west of Northern Ireland. They were a small community, but obviously a community that needed to be heard and wanted to be participating in all aspects of community life. And when I asset mapped that community, there was a wide range of resources, a lot of resources available in that community through statutory and voluntary organisations and community activities. However, a lot of migrant families felt disconnected because a lot of the resources were funnelled via traditional organisations, for example, the GAA. One case in point, PHA had sponsored Action Cancer to place their breast screening bus in the local GAA community, and it was widely circulated on social media through the GAA. However, if you were not connected to the GAA, you wouldn't have seen that. By 6 hours of that being advertised, all of the possible appointment slots were gone. So unless you were already linked in there, you wouldn't have been able to access that. So this resulted in a disenfranchisement in health improvement opportunities, which obviously then leads to health inequalities. And it was that health inequalities that we wanted to tackle, basically. So the aims and objectives of the project were to connect all of the community, not just singling out the migrant or refugee community, with organisations that roll out health improvement opportunities. So unless you had a need to be linked in, you would maybe have missed a lot of opportunities. Some of the families in the migrant community were unaware, for example, that there was a very vibrant organisation in that small town that actually owned a holiday home that could be accessed by any family that had an adult or a child with a physical disability. And many of the migrant families were unaware of that and were unaware of how to even connect into that possibility for them. So it was about connecting the statutory and all third sector organisations who facilitated health improvement initiatives in the community with all of the community, and for all of the community to engage with all the opportunities for health improvement that existed outside primary care provision. So at a suggestion by some members of the migrant community, the project actually boiled down to quite a simple idea, actually, a community health fair, which helped support all of the community make connections. And this actually has become an annual event. So not only the statutory sector, but community organisations, charity organisations that provided health improvement opportunities or social care opportunities, basically took stalls at this event, and that allowed everybody who was in attendance to make contact, make connections, like on Facebook, like on other social media, so that they in turn would equally be able to see what opportunities were coming up. So this project really formed the basis then of what we subsequently termed PCC Support in the Community, which is a radical change to the PCC practice model. Up until this point, the PCC, our practitioners were accessible by a helpline or by an info box. Occasionally they attended health fairs, occasionally they attended community events, but the practice model was really about behind a telephone or behind an email. But the PCC wanted to provide independent advocacy to everybody in the community to combat health inequalities. So we looked at a practice model of how the PCC could actually get out into the community. We developed a clinic-based model, and it was developed in the PCC alongside trusted third sector organisations. There were a lot of organisations already in the sector who were providing support to various members of the population who we had saw were disenfranchised. Migrant and refugee communities, for example, people with disabilities, people with sensory disabilities, LGBT plus community, a whole raft of communities that we were identifying through a Lucid Talk poll, but also through the NISRA Deprivation Index, who were not being able to access the PCC and were unable to get the services of the PCC. So a pilot project took place from November 24 to November 25, and another candidate on our course, Ursula Murray, I think, who's also on the call today, managed the rollout of that project completely while completing her own project for the course, which was working with the migrant and refugee community in a large city in Northern Ireland. And to date, 255 PCC Support in the Community sessions across Northern Ireland have taken place in various communities, and alongside various third sector organisation partners who were the trusted vehicle by which, I suppose, we access those communities. We weren't trusted by communities. Communities didn't know about us, but they trusted the third sector partners that we partnered with. And in that time, there has been over 50% increase in the casework that has been coming to the PCC. And that really speaks to health inequalities, where people in disenfranchised communities were unable to access the health and social care that they had a right to avail of. Things like being unable to access an interpreter, for example, or GP surgeries not wishing to register them because that may imply that, for example, interpreter was going to be required. So more diverse voices were then being heard, even in PCC engagement opportunities. because we also have engagement opportunities where we try to raise the voice of the community in general, in places where policy is being developed and determined. And all of this was put through to the Penny Awards, who are Patient Experience Awards all over the UK. And our team that ran the pilot won Team of the Year. And I thought it was an acknowledgement and a vindication of the practice model and the change of that, but also a vindication of a community development approach. So up until this point, there had been 255 supporting the community events all across Northern Ireland, in all sorts of venues, 41 venues, as you'll see there, 922 face-to-face contacts, and that's alongside 19 community organisations. And we're really still only in the infancy of this. The pilot project has been accepted by the PCC Council and our executive management team as now business as usual in our practice model. So not only do our practitioners operate the helpline, operate the inbox, but they also operate these PCC support in the community sessions. And they are continually reviewed to ensure that we are reaching all elements of the community, all aspects of the community, all geographic areas of the community. And our Lucid Talk poll over the last year, we do one annually, is showing definite increases in people being an understanding of what the PCC do and an ability to access them. We have a long way to go. There are a lot of communities who are still out there, men in particular, rural men in particular, young people, students. There are whole rafts of communities that still really don't have a lot of knowledge of the PCC, but we continue to work on that on a community development basis. Our third project, which is ongoing, and Linda Doherty-Riley, one of our practitioners, is working alongside the Roma community. And her project is focusing on asset mapping, health, social, food and practical resources across a large area of a major city in Northern Ireland. So Roma and other communities can source that. And a QR code has been developed. And the project has a sustainability plan in place to allow for updating as new resources become available. So that's in summary, I suppose, the approach that the PCC has taken, which was primarily triggered really by the community development course, me attending that course and looking at ways about how the PCC can reach out into the community and looking at how we, on our side of things, can help tackle those health inequalities and reaching out to those communities and people who find it hard to reach us. We don't refer to them as people who are hard to reach. They can't reach us, or they can't access the health and social care that they deserve to have. And the PCC can offer them that support and advocacy, but also to get their voices heard at policy level, so that policy can be decided with a variety of voices being heard, and that too is part of our community development approach. So thank you for allowing us to talk about the PCC, and I'm happy to take any questions.
Okay, Catherine, that was a very, very inspirational presentation, and fantastic outcomes from that particular project. Like, it's really, really, really good, and it's just showing you a practical model for the health inequalities. It's like common sense, going out and engaging with people, but also working very much and closely in partnership with the voluntary community sector.
That was absolutely key to the success. The community sector were the trusted partners in all of this, and the communities that we were trying to reach trusted the third sector community or community organisations primarily before they'd trust what they saw as a statutory organisation.
It's such an important message that you can't just cold call. I mean, we all of us can think ourselves about the cold calls we get and people trying to defraud you, all that kind of stuff. And you really need some sort of trust with folks, and you're really showing how that trust. And this is interesting too, as an introduction into our next speaker, who's coming very much from the voluntary community sector, Paul Kelleher. And, one of the things that, the observation, obviously, when you come on the course, you learn about the history of community development and how a lot of stuff through neoliberalism, climate, or whatever has been contracted out to the voluntary community sector, and people have largely, very often lost the skills, the community development skills within the statutory sector. And a really important message for us to people is that it's important to respect what's already out there, and to work with people who have a lifetime of experience in this area. And it's not about replacing those services, it's really bridging those services between people in the community and people within your particular agencies if you're in the statutory end. So we've a really interesting, the other bit is that, so much of social work is focused on casework, and we neglect the macro, the bigger picture, the general society picture. And what we're really going to have here from our next presentation is another intervention from Paul, he was formerly, Action for Children, and he's now an independent social worker. And he absolutely worked at that strategic level with local councils, looking at child poverty. And it's really, I'm delighted, Paul, you were able to join us today, because you're a busy guy like all the rest of us up and down the country. So over to you. I'll make sure to unmute. You're muted, Paul, just to unmute, yeah.
Sorry about that. I think we'll be used to this technology by now. I'm not. Can you see my presentation okay, Fergal? Okay, great. Thank you very much, Fergal, for the introduction there. Yeah, so as Fergal said, my name is Paul Kelleher. I'm an independent social worker now. And I'm director of a community interest company, and there's a bit of a correlation there, and it kind of I've ended up almost back in kind of community development and community work. But at the time of my work on the community development course, I was Children's Services Manager for Action for Children out in the West. And that's very much the context of that. I was in a leadership position as Children's Services Manager. So in a way that, that felt a wee bit different on the course. I wasn't involved in direct practice. I was managing a cluster of teams across the sector. That kind of area that I was managing was a kind of very large rural area across the West, kind of across Fermanagh and Omagh, about 3,000 square kilometres. And it was in the years immediately following the COVID-19 pandemic. So there was a lot of issues about loss of earnings and rapidly rising cost of living that was pushing many families to the brink. And a constant theme of discussion in my team meetings with my leadership team and with the social workers and family support workers in our teams was this kind of impact of poverty that almost had to be addressed before you could do any other work. It was the kind of piece that had to kind of be foremost in conversations. Action for Children was a charity that continues to be heavily involved in addressing child poverty, but also a charity that was a campaigning charity involved in trying to seek policy change. The charity at the time had set up a crisis fund. But what I found from my community development audit at the start of the course was local responses across the community were quite fragmented. There was a mixture of kind of smaller and larger community organisations, community and voluntary sector organisations, and the statutory sector, all kind of grapple with this kind of growing crisis of poverty. One of the groups I identified within that was young people leaving care. And they were often unseen in that kind of families in poverty lens, because in many cases they didn't have that extended kind of network of family support. And I felt, kind of being in a leadership position, it was really important to use that kind of position of authority and position of leadership to think about how do you bring those voices to the table, and bring those voices indeed to the table at the kind of highest possible level. So I ended up kind of working, I suppose, in both a community planning kind of area. I was a member of the Western Area Outcomes Group, multi-agency group in the West, as part of the wider Children and Young People Strategic Partnership. But I was also quite involved in the kind of policy work that the charity was doing. And it led me to think about these, questions about when politicians and elected representatives meet their constituents, does this change their thinking? And do we as social workers have agency to speak on behalf of the families we support? Hagelater in 2022 kind of looked at young people leaving the care system, and they're at a much greater risk of things like homelessness, poverty, and that was certainly reflected in many ways in very simple kind of issues for young people. It was issues about just paying the bills, paying the overheads, gaining housing in the first place, the construction of the housing market, and the increase in what would have been kind of small apartments having it turned into Airbnb. We're all kind of having a wider impact, as well as this kind of rapidly rising cost of living. So we know that the very wealthy can use their resources to influence politics in ways that ultimately protect their assets and redistribution. And that's from Barthel's kind of study in 2016. So I guess the question is, why shouldn't we, and by we I mean both the professional community of social workers, social care workers, but also, how do we get our community's voices to those tables? And I guess at a personal level, this was kind of always about social justice for me. It was about this kind of idea, about what were the barriers to speaking about child poverty in social work practice. And NISC has very good guidance on kind of child poverty and assessment around social work, but I kind of wanted to take it outside that into a kind of a policy piece. I suppose it was interesting things like, how does it impact on factors such as parental stress, housing, homelessness, and really, can any of us function as parents effectively if we're consumed by stress in relation to the most basic kind of Maslow needs of food and shelter? Were kind of some of the challenges for me. So I guess as I intimated there, it kind of was a mixture of community planning and policy and influencing. And one of the things that I became very active in was the charities campaigning and policy work, and that involved speaking to committees and stormont, speaking to MLAs. But I also took a kind of fairly direct approach with a local newspaper and started writing a column in the local newspaper about this piece. For me, this was always a wee bit less about a project in the sense of, the duration of the community development course, and much more about enabling a shift in the long-term culture and thinking. So being in a leadership post, I think, Simon Sinek, also often a kind of leadership guru, often talks about asking yourself the question, why? Why are you doing it? And for me, as I said, it was very much about social justice. Growing up in the 70s and 80s, I was kind of one of those children of the early periods of neoliberalism in our society and the wider impact that has had. But my community also involved a wider professional group of key leaders. So at the time, one of the pieces of work I took on was chairing a task and finish group in the Western Area Outcomes Group, looking at child poverty and the impact of child poverty. But it also included meeting with young people to ensure their voices contributed to the wider charity work on campaigns such as A Place to Call Home. Some of that was also about internal leadership. I was also chairing an Action for Children Northern Ireland participation group with a key focus on engagement with young people to ensure their voices kind of were brought to the table as well. And a lot of that was, kind of in many ways in a leadership role, kind of remote. You do a lot of the work through the work of your teams. And trying to kind of steer that work and kind of include that work. So that was making sure that all of our teams were engaged in that conversation with our policy team as well. And I guess finally, the kind of outcomes for me, I'm trying to kind of keep the time here, we very much got young people's voices at the heart of the charity's work, and that was included in a piece of work I was doing with Fermanagh and Omagh District Council, who produced this very early piece of work on poverty. It was called Pathways to Poverty, an anti-poverty strategy for Fermanagh and Omagh 2024 to 2034. That has very much continued to lead the council's local work. It's important to note that that piece of work was done before the Northern Ireland Executive had produced their draft anti-poverty strategy by about 12 months. So it was quite ahead of the kind of pace at that stage, and working with all of that wider community partners and the council's community development department was really important. And it was also ensuring that our policy work, things like the Charities All Worked Out campaign at the time, was brought kind of into political focus and was part of a team that presented on that to some Stormont committees as well. I guess for me, some of the challenges is, can you sustain that sort of work within, the kind of community and voluntary sector, because the community and voluntary sector has to pick up a huge load there in terms of work that, in many ways it was never really designed to do in terms of, addressing the kind of wider social issues within society. And can a public policy approach deliver social change in a dominant neoliberal kind of approach to culture? And I guess finally is, how do we, as social workers and social care workers, kind of lift our heads above that kind of, here and now of what we're trying to do in a busy workload, and connect with others in our community and connect with our communities. So that's kind of my thoughts on that. Thank you.
Thank you very, very much for that, Paul. I know that you have been an absolute champion, and I think there's another theme that could run through a lot of our work here, and it's really around the value of social justice. And I think people, social workers who are, really true to their own values and also to the standards, really seek social justice. I think that's what's really been driving you, and you've had some great impacts on that there. And it's also, there's part of the social work course actually looks at radical social work, and radical just means change. You're looking for social change, and this is a very good example actually of radical social work, where you're actually looking at policies, and you're looking at sort of changing things for the benefit of everyone. And I think if we went back to Brendan at the very, very start, Brendan's presentation was another brilliant example of radical change, and not just for his family, but right across Northern Ireland, Wales, and Great Britain or England. I mean, when you look at that there, that's an incredible result. But that took a lot of campaigning and a lot of working in partnership between professionals, etc. And those themes again are really reflected in your presentation. And there's not all of us as social workers might be working with local councils, but it's a good example of what you need to be doing with a local council to affect change. And you were involved in community planning there with the council, and you were involved in changing the kind of poverty awareness within that council, and that fed in then to MLAs as well. So it's a really, really good example of social justice, good social work practice, really good social work practice. So I'm going to move on, folks, and as I say, we'll maybe allow for some questions to all the panel at the very end, because we're moving on at a nice pace here, and we're actually keeping to time, Alison, which is very good. We're very much, in fact, we could be slightly even ahead of time. So we're going to move on to my final speaker, and another person who's currently on the course, Michael Ferris. And Michael, really, we've heard a lot about the Jones Report and the reform of children's services. And I think really this man is coming out of that context, and is really this is a cutting edge example of looking at the whole children's services and early intervention and prevention. And I know that this is gaining traction right across Northern Ireland. So what you're seeing in here, certainly there are other examples across Northern Ireland of this in each of the trusts. But Michael, I'm delighted to have you here, and over to you.
Thanks very much, Fergal. Can you hear me okay? Yeah? Yep, that's great. I know it's funny, I got so immersed in listening to their speakers, I forgot that I was actually speaking myself. So, look, good afternoon, everybody. It's a real privilege actually to be part of this today. And I suppose just to give you a bit of context about, I suppose, where I've come from. I've probably been involved in youth and community work in the earlier part of my career, and that probably sort of built my transition into social work. So I've been involved in youth and community work probably for about 10 years, and I've been a social worker or a social work manager or service manager, and now a children's reform and change coordinator over the last 30 years. And it's interesting even just listening to some of the points that Paul had mentioned earlier, and Fergal and raising the neoliberalism, and the opportunities that I had probably in the early 70s, 80s and 90s in relation to being exposed in West Belfast, that, really, I suppose, people who presented with real expertise in relation to community development. And it was interesting how I entered into social work and that seemed to ebb away a bit. And it was, I suppose, only when in reflection and attending the course that I really sort of was a bit more thoughtful about that, and you were able to anchor in then some of the sort of theories and the academic sort of thinking around why that's happened. So I suppose just to say to you, look, I am going to do a wee bit of presentation here and an overview in the context, but before I do that, just to say that I've been really privileged and humbled, not only by the young people that I've had the opportunity to work with in this project, but also just the energy, the action that has been extended to us from Fergal and the UU team, and also what that's generated for us, I think, as a peer group, and being exposed to all those other people who are working within their community development projects right across the region, and also our guest speakers. Now, Brendan's here today, but Brendan was a number of people, including some of the service users that attended that course, and I would imagine, you know, like Paul and stuff who's on the course with me, would acknowledge that has been, you know, it's just been such a positive experience for us, and there's been so much learning from it. I suppose just as well, I know I'm on the graveyard shift and this as a final speaker, but I will try to be succinct, but I really do want to leave some sort of takeaways and thoughts. And I want to encourage you as well, just in terms of the ethos of the course, if there's any critiques or any feedback, please put them in, because this is a pre-presentation for me and I'm due to do it next week in front of my mentor. So I would welcome any feedback at all, just in relation to that. Before we move on, I suppose it was reflection and action for me, and I was thinking a bit about what I was like when I was a teenager growing up in West Belfast. And I know that Brendan and the likes of Paul and Fergal have mentioned, I suppose everybody, even Catherine, in relation to how key relationships are. And I was thinking back to a youth and community worker who encouraged me, and it's something about the right person in the right place at the right time, and how we shouldn't diminish that. So I'll just give you a wee anecdote in relation to what happened. So I was attending a youth club. There was 4 of my peers who were encouraged along with myself to apply for a paid youth work position that was in partnership with North and Belfast Community Unit and the Youth Service. So we had limited resources. We weren't long out of school, and we'd got preparation then by this key person who had helped us sort of with the application and the interview process. Now, what we realised was we weren't long out of school, so we all had crisp white shirts, a pair of trousers and a pair of shoes, but we only had one jacket between us. So that was fine. So we all made the interviews. We went for the interview, and the 3 panellists were very kind in terms of encouraging us and hearing each of our sort of interviews. But I was last in. Now, to put this in perspective, there was 5 of us. I was the shortest. I was 5'9", and I had a friend who was 6'7". He owned the jacket. So you can imagine then, by the time I got to the interview, I had the Miami Vice said, roll up the sleeves and enter the interview. Now, the reason I'm telling this story is the panelists were very kind. So before they asked me my first question, they asked, Michael, can we just ask you something outside of the process? Is there a sale on those jackets? So what I took from that was, look, you know, limited resources can be really turned into success. Now, lucky enough, I was one of the 2 people who had got that post. And I think when I think about that, I think about the young people that I've had the opportunity to engage. So just looking at the presentation overview and context, I suppose the presentation outlines a community development project focused on improving outcomes for care experienced young people through co-production, partnership work and evidence-informed practice. As we all know, and there's no surprises here, care experienced young people often face significant structural disadvantage. And you know, Paul touched on this as well, across education, health, housing and employment. And these outcomes are shaped less by individual deficits and really more by systemic and relational factors. My sort of aspirations along with the young people was that the project would recognise that meaningful change requires collaboration with the young people themselves, valuing their lived experience as a form of expertise alongside professional knowledge. So I suppose my hope, and you know, the community development process, the structural disadvantage, the collaborative change, and the presentation structure is all on the slide there. I don't want to ponder on it too much, but really over the next sort of 15 minutes, the presentation that I hope will summarise the project's rationale, its aims, the SMART objectives that were referred to, I suppose the plan timeline, because this is active at present, a SWOT analysis, a risk assessment, looking at partnership approaches, leadership and capacity building considerations, and really the change management framework, and of course then considerations in relation to proposed exit and strategy, sustainability. I suppose what I do want to sort of emphasise, this isn't a service design imposed on young people. It is a participatory process designed to strengthen practice through shared learning. And I suppose the position the work clearly within the community development ethos and highlighting empowerment and taking, I suppose, consideration in relation to what Brendan was saying and being careful about that use of that term, participation and sustainability as core values. So Alison, if you're happy enough there just to move to the next one. Yeah, this is quite a limited slide, but I thought it was really important to actually just to, have a think about this as well in terms of our language sensitivity and co-production. This isn't surprising to, I suppose, anybody that's here today and has already been touched on. But I suppose being thoughtful just in terms of the engagement with the young people who were involved in this project, that the phrase care experience is used deliberately to acknowledge the diversity of experiences within the care system and really to avoid any deficit-based labelling. And that came from the young people themselves. Now, to say that there's flexibility within this project always, and each time I meet with the young people, they'll tweak something, which is really, really important. And I think it's a real strength in terms of that community development process. So I suppose not only does language matter, particularly when working with the young people who have experienced stigma, instability and marginalisation, I suppose it's really important to say as well, although there's a working title here in relation to voices aren't enough, again, that title remains, there's always the opportunity to refine that through consultation with the young people and reinforcing the co-production element from the outset. So in terms of the rationale for the project then, Alison, if you don't mind moving on. And just the next one, please. Yeah, that's great. So as you can see, I suppose the challenges for our care experience youth, care experience young people, as we've already said, face a number of challenges, and that really needed focused support. I suppose in the work so far with the young people that I've been involved with, they have said that they've had the opportunity to raise themes on numerous occasions in terms of the challenges that they face. They also wanted to shine the light in relation to their own journeys and the success that they have gained from that. And it's interesting, and I will say a wee bit about it later on in terms of the young people that I have been working with. Probably out of, I think we had 6 young people were involved, and they were panelists in a care a care leaders event in November past. And each of those young people, in one way or another, are involved in jobs that are giving something back to their community. So whether that was social work, the same in community, the YMCA, Lakewood, so they've actually really turned their own pain into a lot of gain, and they sort of wanted to celebrate that success, but really acknowledge the challenges as well. So again, we've touched on this in terms of the importance of trust and relationships. Stable trust and relationships with professionals are key to improving outcomes for our care experience young people. And what we noted that this was a byproduct as well. So although we wanted to shine the light on our young people, we wanted to hear what they had to say, which they've said numerous times, but we wanted that to be put into action. And that's so hopefully what the project is going to help us do in terms of a real launch pad into action. And of course, doing that with our young people with the potential and I suppose the aspirations that they'll take the lead when we exit the project. So in terms of the Gap and Co produced resources, I suppose there was a real acknowledgement, I think, then whilst I was undertaking the course, of course there was tools in terms of exposing these gaps, and there was a real lack of locally co-produced materials or resources reflecting youth perspectives during transitions leaving care, and our young people were really clued in relation to identifying this gap as well. So I suppose in terms of supporting practitioners and youth, the project aims to boost practitioners' confidence and competence and improving youth experiences together. But it's interesting not only for I suppose the young people, this was a byproduct in terms of the practitioners, because what we found then that we were probably lacking in some of these areas in terms of our knowledge, raising our skill set and working really alongside our young people in terms of learning, but also having those key relationships with them. So I suppose in terms of language, particularly when working with young people. I suppose I just want to reiterate that our young people haven't experienced that stigma, instability and marginalisation. They would have highlighted, I suppose somebody had mentioned earlier about abbreviations. One of the key ones, and there's been work has been done around this, is in terms of referring to looked after children. And our young people are adamant, that they want to change the language that's used in relation to them, about them. And I think it's right too. And I know that there has been some activity around that. But again, our young people were voicing that in terms of, lack, for instance, indicates that they're lacking something. And I think there's that sort of language and sensitivity has to continue to be addressed and challenged. And again, I think this was, I suppose, an opportunity for us to have a think about that. So, suppose in relation to just expanding on the rationale for the project, the care experienced young people are consistently overrepresented in negative outcomes statistics, including poor educational attainment, mental health difficulties and homelessness, I've already said. But I suppose the link for the rationale, the local practice pressures such as workforce turnover, newly qualified staff and competing demands have probably been a bit of a challenge, I think, while we have been undertaking this project. Really to emphasise that the project is as much about supporting practitioners' confidence and competence as it is about improving our young people's experience. So in terms of aim and SMART objectives, just briefly refer to that. Thanks, Alison. That's great, thank you. And I'm not pondering others, but basically the overall aim of the project was to co-produce a practical, accessible resources that supports professionals to more effectively work with care experienced young people, particularly during key transitions. Paul, I think you noted then just in terms of that one in relation to leaving care, and each of the young people that I've been working with have already made that transition. Some quite recently, and some are currently now in their late 30s. So I suppose in terms of the SMART objectives that really want to underpin the aim, as I suppose first by a specific start date, a working group of participants will be established, including care experienced young people, social workers, education, allied health professionals and community and voluntary services. Now that's not, it's actually expanded. We're due to do a presentation next week in relation to this, and it's about feeding back to our young people from the Care Leavers event that we had in November, and it's really highlighting the action that has been taken from them raising their themes. And the membership of that and the stakeholders are involved in that has expanded extensively beyond these participants. I suppose the second one then was within a defined 6-month period, the group will co-produce resources and prioritise lived experience while integrating evidence-informed practice. I suppose unbeknownst to our care leavers, there's actually a number of, pieces of work that's been identified by them that are 16 plus service and the head of service, Johnny Dillon within the Northern Trust, and his team have been really active from these themes have been raised. Now, I don't want to preempt that because our care leavers haven't heard that yet, but that is going to be fed back then to them, and they're going to be part of this in an event next week in terms of the presentation and doing that in a co-production way. But really, I suppose the third point, the resource is going to be launched within the organisation and evaluated through feedback, both from young people and practitioners within 6 months implementation. As I say, that's going to happen next week. So explicitly, I suppose, I wanted to connect each objective to the SMART criteria and really wanted to demonstrate clarity, measurability, and realism. This is particularly important, I think, I suppose for us to acknowledge as we move forward in relation to the project and looking at the project timeline. So Alison, if you're happy enough to move on. And I suppose just to give you a wee flavour just of where this started, I referred to an event that we had, I suppose, in November 2025. That energy that came from the course, I probably underestimated because I kept saying to Fergal, look, this is going arms, legs and feet. The PSS seems to be getting away with this. There was a lot of energy around it from the course, which then transferred actually into our young people. They were really engaged, and quite quickly with the learning on the course and also the motivation of our young people and those key people around them, we quite quickly then developed an event then from September to early November, where we had 5 to 6 panelists of our young people who had experienced that care transition. They were all from, I suppose, quite different backgrounds, but also there was probably an acknowledgement of the people that weren't around the table at that time. And I think that's a learning point for the future in terms of making sure that we have young people, potentially in relation to disability or unaccompanied minors, various different people who weren't around that table that would need to get involved. So that co-produce event then took place in November and was really, really successful. But on the after sort of thought about that and reflection with our young people, they were saying, no, that's great, but Megan, what are you going to do about it? What's the community involvement organisations? What's the supported living? What's the housing executive? What's social work going to do? What's education going to do? They were asking all the right questions. So, we need to really have a think about that. So, we'll say then they establish the focus groups and look at the power cycles. And we're currently still involved in that. And as I say, the feedback sort of in presentation that's happening on the 15th of June is going to be part of that as well. Our young people are taking the lead in relation to co-producing that presentation, but also, I suppose, to revisit the themes that they have highlighted, but also then the feedback in terms of the action, particularly from the 16 plus service. And our hope is that in relation to sort of late 2026, probably timely in around Care Leavers Week, that we will have some kind of output and evaluation in relation to that.
Michael, would just sort of say maybe if we could do our 2-minute wind up because we're just
No
coming
worries.
time.
Okay.
Yeah.
So if we just move on to the other one, Alison, if that's okay.
Yeah.
And again, look, it was just to sort of acknowledge then that the SWOT analysis had been completed, and it was really looking at the strengths, the weaknesses, and the opportunities for growth. The only thing I want to highlight there is probably about the power imbalances and scope creep. Our worry was that this was going to be tokenistic, and we didn't want that. The young people didn't want that, and we certainly didn't. And I suppose that was an area that we felt was a clear threat that needed to be addressed. So if we just work on or move on then, Alison, sorry. And again, then, just in terms of partnership work and capacity building was really central to the project, and that was about bringing together statutory services, third sector organisations, and care experienced young people. And I suppose just looking at the practical examples such as shared facilitation, accessible meeting formats, and really valuing creative contributions for our young people. So sorry, just move on quickly again, Alison, then in terms of risk assessment. Yeah, it was really, really important that I suppose this, psychologically and I suppose physically, our young people had felt safe in relation to that. And it was consideration, I think, given in terms of the potential risks and how we would mitigate those. So just again, that power imbalance and having sort of right-based participation. And I suppose engagement fatigue as well was an important one in terms of having, that flexibility around engagement. I suppose we really did try to mitigate this by adopting flexible engagement approaches and really consider capacity and avoid overburdening our participants. So we just move quickly into the next slide, sorry. Yeah, so again, look, these themes have been raised. I think that the presentation further probably can be shared if people feel that that's something that's going to be useful for them, but I'm not going to ponder on that. What I want to do is move to what the care leavers told us. Just move on again, Alison. Apologies. On again, sorry. On again. No, back one. That's it. No, you're too far, Alison, sorry. Yeah, that's it. And this was really important. Again, there have been no surprises in this, but our young people, care leavers emphasised the importance of early and gradual preparation for independent living. Access to life skills, practical life skills was identified as essential for care leavers in terms of their transitions, and really just the trusted relationships and the meaningful involvement was really, really important, I think, in terms of keeping that at the forefront. There was then, just moving on, very clear sort of exit strategy and sustainability aspirations. But given the amount of time, I suppose, that we'll have left, just want to thank everybody just for listening. And Fergal, sorry for dragging that on a bit.
No problem at all. And Michael, I'd love to thank you very, very much for that presentation. And your passion and energy is fantastic, because I know that there's a minimum, on the course. You present to 6 people, so you've grown into about 60 plus, so it's unreal. So it's fantastic the way that you're, you've brought so many people and you've really engaged people and you've applied stuff. I also want to thank everybody that's presented today. I really, really appreciate it, because we got to share learning, we've got to share best practice, and a big thank you to Nisk and Alice and Shaw for making this possible. And they put a lot of energy into developing this website. And even though the focus today has been on the postgraduate examples, we've also got great examples from the undergraduate world. And each year there's the Northern Ireland Degree in Social Work Partnership as an annual review, and there's cutting edge examples of community development at undergraduate level. So we've captured some of that on the website. So we're hoping that the resource is useful to everybody involved in community development, whether you're undergraduate, postgraduate, or just social workers that want to kind of improve your practice and take in alternative methodology that goes beyond maybe looking at common themes that cut across the cases. Like there's common themes in particular areas that merits maybe community development interventions. But thank you so much for everybody. Also, all the people that came today, that give up your time to come along.